Superficial bladder cancer is the fifth most common cancer worldwide. The number of cases is on the rise. The average age for sufferers is falling. And once treated, the disease recurs at a staggering rate, usually within 2 years. Current treatments have had little success in lowering bladder cancer recurrence and reducing the need for radical surgery. Fortunately, there is a powerful new modality for fighting bladder cancer. Medical Enterprises presents Synergo, an effective new treatment for superficial transitional cell carcinoma of the bladder. Synergo is a unique system that simultaneously combines heated tissue and chemotherapy. The patented Synergo treatment destroys tumors effectively and selectively using heat together with intravesical drug therapy. Synergo's method of combining hyperthermia and chemotherapy produces an effect far greater than the two treatments individually. A typical treatment regimen requires 8 weekly induction treatments and 4 monthly maintenance sessions. After just a few sessions, tumors are steadily ablating and no new lesions are detectable. At the end of the regimen, excellent results are evident. And those results are lasting. The Synergo system offers a minimally invasive outpatient therapy for effective ablation of superficial bladder cancer. Studies have also shown that the treatment dramatically reduces recurrence rate. The treatment is applied to the entire organ, but its specificity enables it to destroy cancer cells selectively. Tumorous sites show extensive necrosis, while healthy tissue remains nearly intact. The benefits of combining chemotherapy and heat are well established. Numerous in vitro and in vivo studies have shown that local hyperthermia boosts the effectiveness of cytostatic agents in a number of ways. Heat improves drug perfusion and increases its concentration at deeper layers. At the cellular level, heat increases diffusion of the cytostatic drugs to the cytoplasma through the cellular membrane. Heat also increases the drug's rate of activity within the cell. And with heat, DNA repair is inhibited. All these mechanisms render the combined action of heat and drugs highly effective and extremely specific. Until now, however, attempts to develop a suitable technology for implementing this combination therapy have failed. Irrigating the organ with a hot solution was found to be ineffective because the heated solution failed to maintain the needed heat uniformity and depth of penetration. Synergo uses localized RF energy to deliver homogeneous diffuse radiation and controlled heating to the entire bladder surface. Exposure of heated tissue to cytostatic drugs allows for a highly particular effect on cancerous tissue. Typical papilla shows fibrovascular stroma and many layers of neoplastic cells. During Synergo treatment, the fibrovascular core of the papilla is typically enlarged and sclerotic. It is covered by a few layers of cells with vacuolization and spongiosis. Synergo induces hyperthermia via direct irradiation using a specially designed intravesical microwave applicator. The applicator is positioned in a transurethral catheter designed to deliver the local hyperthermia. Thermocouples help ensure that the temperature at the superficial layer of the bladder walls is kept steady at 42 ± 2 degrees centigrade. The cytostatic solution is administered through this same operative catheter. Physical parameters are continuously monitored with a computerized unit that ensures accuracy and safety. Repeated studies have demonstrated that Synergo's action exerts a direct and selective effect on tumoral cells, even in cases of numerous neoplasms. In the case shown here, the physician initiated transurethral resection. Necrotic areas resulting from the TUR are visible among the many papillary tumors. But faced with the extent to which the tumors have multiplied, options are limited. Repeated TURs, radiotherapy, chemo, Or is this clearly a technically unresectable case with little choice but total cystectomy? This patient underwent Synergo therapy. And indeed, after a few Synergo sessions, the bladder is nearly clear of tumors, with just a few limited necrotic patches remaining. The full series of treatments leaves the bladder dramatically improved. These results are representative. Studies so far have shown that at least 2/3 of such patients will either become disease-free or reach the level at which TUR will be both possible and effective. Because it is minimally invasive and can be administered without anesthesia, Synergo is an ideal therapy for high operative risk patients. And with its specificity, Synergo is also a highly effective prophylactic treatment for medium risk and even high risk patients. Patients treated with mitomycin C instillations alone show a 60% recurrence rate. For Synergo patients, the rate is less than 20%. Synergo is also user-friendly and fast, making it preferable for both physicians and patients. Synergo offers the physician a therapy that not only works, but is fast, simple to administer, and cost-effective. Synergo improves patients' quality of life. The treatments are safe and cause no major side effects. Patients can leave the clinic after sessions and return to their daily activities. Convenience, comfort, speed, and above all, results. Synergo succeeds both as a prophylactic measure after TUR and as a therapeutic modality in more advanced forms of bladder cancer. Synergo, the winning combination for bladder cancer.